I am going to call upon the stage one of our esteemed guests, Dr. Chung from NanShan Group, and he's going to continue the conversation around health resilience. Dr. Yao Ying, could you come up to the stage and can we give him a warm hand of applause?
Ladies and gentlemen, good afternoon. It's my honor to represent NanShan Life Insurance of Taiwan here in Belém. Belém is known as the gateway to the Amazon. The Amazon rainforest absorbs roughly 5% of the world's carbon dioxide, moderates global temperature, and sustains ecosystem indigenous cultures. As we safeguard our planet, we must also protect the vital lung of the earth. Yet the Amazon continues to face immense pressure. In 2024 alone, 6.7 million hectares of primary tropical forests were lost, an area nearly twice the size of Taiwan. This loss threatens water systems, local livelihoods, biodiversity, and contributes to global greenhouse gas emissions. Last year was also the hottest on record. Ecological disruption also affects human health. Deforestation pushes wildlife toward human communities, increasing the likelihood of zoonotic diseases. Recent outbreaks of mosquito-transmitted Oropouche fever in Brazil illustrate how environmental degradation can quickly become a public health emergency. For indigenous people living in climate-vulnerable regions, those pressures endanger cultural survival, dignity, and well-being. Taiwan shares a deep relationship between forest and indigenous communities. Of Taiwan's 3.6 million acres of land, 2.2 million are forested, absorbing over 21 million tons of carbon dioxide annually. Taiwan practices a co-management approach where indigenous communities participate in ecotourism, forest stewardship, and community-led resource management. This partnership reflects a fundamental belief. Those who live closest to the land should have both rights and responsibilities in caring for it. Yet significant health inequalities remain. Taiwan's average life expectancy is 80.2 years, but among indigenous people living in mountain regions, it is only 71.6 years, nearly 9 years shorter. Limited medical access, geographical barriers, and insufficient health education are major drivers. Climate change further widened this gap. Heat stress and extreme weather increase risk of dehydration, cardiovascular strain, and mortality. As Taiwan's largest independent life insurer, NanShan Life launched the Indigenous Community Care Initiative to strengthen resilience to remote regions. We focus on 3 areas. First, improving medical access, supporting telemedicine equipment, maintaining village health stations, and assisting referrals to regional hospitals. Second, advancing health promotions, delivering medical outreach, chronic disease education, and age-related care programs. This year, we expanded dementia screening and awareness among older indigenous populations. Third, integrating health resources, partnering with hospitals and NGOs to provide long-term personalized health management across indigenous communities. In 2024 alone, our program served over 34,000 residents. NanShan has also joined Taiwan Climate Heat Adaptation Alliance, and we are developing climate-responsive insurance benefits that incorporates heat-related risk into life and health coverage. We believe insurance must use underwriting insight to protect public health and support community facing climate changes. With nearly 300 service centers and more than 30,000 agents across Taiwan, NanShan Life maintain a natural disaster response network to mobilize rapidly and support affected communities. This aligns with COP30's focus on indigenous people and local communities, and recognize the essential role of local capacity in disaster resilience. As a financial institution managing more than $180 billion in assets, NanShan Life is committed to mobilize capital towards sustainable health, longevity solutions, green energy, and climate resilient development. Our ambition is to ensure that financial strength contributes directly to societal and environmental well-being. In 2023, we highlighted our health protection circle to promote preventive health through multi-sector partnerships. In 2024, we pledged to reduce health inequality exacerbated by climate change. This year, we continue this mission. Beginning in 2025, NanShan Life introduced a sustainable health framework built around 5 health accounts: personal physical health, lifestyle and behavioral health, workplace and organizational health, social equity in health access, and environmental and planetary health. Our goal is not only to raise awareness of these interconnected dimensions, but also to encourage individuals and communities to proactively build health capital. This approach reflects our belief that health is a long-term asset, one that requires investment, protection, and collective stewardship. This is not a slogan. It's a commitment we account for delivering. NanShan Life aspires to be a leader in sustainable health, standing at the front line of climate and health challenges, and using financial capabilities to protect both people and the planet. Blame is where the heart of the Amazon beats. As we gather here at WCS, may we ensure that the heartbeat remains strong, a rhythm of harmony between nature, people, and our shared sustainable future. Thank you.
Thank you very much, Dr. Yao Yin. Last year you were in Baku online, and today you are here in person. Such a pleasure. Thank you very much.